My name is Dr. Stephen J. Smith. I have a busy, wonderful dental practice here in Salt Lake City. In our office, we treat many patients with periodontal disease, which is a bacterial infection causing chronic inflammation of the soft tissues and destruction of the underlying bone surrounding the teeth. Periodontal disease affects 85% of the adult population. It ranges in severity from gingivitis or bleeding gums to advanced periodontitis involving bone destruction and eventual, horrible thought, tooth loss. Chronic gum disease, periodontitis, affects the overall body health. In the past, the mouth was treated separately from the rest of the body. It was wrongly thought that infections in the mouth had little effect on the general health, but recent medical studies conclude that the bacteria in the mouth has a direct pathway into the bloodstream through inflamed soft tissue supporting the teeth, therefore creating a direct link between periodontal health and other systemic conditions. For example, bacteria from the mouth cause clotting problems in the cardiovascular system, increasing the risk of heart attack or stroke. Adults with periodontal disease have a 6 times greater risk of developing Alzheimer's disease. Chronic periodontal disease can disrupt diabetic control. Now here's one I don't like. Women with advanced gum disease are more likely to give birth to an underweight or preterm baby because bacteria from the mouth can cross the placental barrier. Inhaling bacteria from the mouth can also lead to pneumonia because dental plaque creates a dangerous source of bacteria that can be inhaled into the lungs. Liver and kidney diseases can be linked to the systemic bacteria as well. Now, when unwanted diseased bacteria get into the bloodstream, it's called a bacteremia. Thus, unhealthy bleeding gums, when you brush or floss, can result in a systemic total body bacteremia. Bleeding gums when you brush or floss is not, I say again, is not normal or healthy. The mouth must be healthy or else a compromised systemic body health will result. People who came from an unhealthy mouth to one of healthy reported that they have more energy, just basically feel better. Recent studies have shown that people with healthy gum tissue have higher levels of the antioxidant glutathione in their saliva. This is an antioxidant naturally produced by the body. There are also studies that indicate that a diet high in antioxidants can help reduce the risks of gum disease. We were introduced here at this office to Shusai, and because of its high ORIC value, we felt it could be beneficial to our patients suffering with periodontal disease. We decided to do a periodontal study using Shusai. We enlisted volunteer patients with slight, moderate, and advanced periodontal disease. Each patient had an initial periodontal screening here at the office to establish a baseline of gingival health. All patients had mild to severe inflammation and bleeding gums, and periodontal pockets ranging from 2 to 8 millimeters around the teeth. It is only normally 2 to 3 millimeters with no bleeding upon probing. Each patient was asked to take 1 ounce of Shusai 3 times a day. Each month, we then performed periodontal screenings to record individual bleeding and progress. Now here are our findings. We studied 22 patients, 8 women and 14 men. Initially, 19 of the patients had periodontal pockets of 4 millimeters or greater. Remember, normal is 2 to 3 millimeters around each tooth with no bleeding, and all 22 patients had an average of 38 bleeding points. This means bleeding occurred in 38, can you imagine that? 38 different places in the mouth when the dental measuring probe was gently placed between the gum and the tooth. At the 3-month periodontal checkup, of the 19 patients, good news folks, of the 19 patients with diseased pockets, 95% showed reduction of 1 millimeter more, and 82% had significant reduction in bleeding. Of the 22 patients who participated in the study, this is good news, 100% of them showed marked improvement in pocket depth reduction, gingival bleeding, or both. The patients were excited and delighted with this progress. These patients added nothing more to their daily routines other than taking 1 ounce of Shusai 3 times a day. In a couple of cases, patients wanted to see, okay, is this real? Let's see. they decided to stop taking Shizai, and for 1 month, and sure enough, the bleeding gums returned. Taking Shizai again restored them back to healthy gums. Shizai was an on and off switch for a healthier mouth. Along with the benefits our patients experienced with their gum health, some also experienced more energy, bowel regularity, changes in their skin, weight loss, and less craving for sweets. We have one patient who has been able to cut her antidepressant dosage in half. Taking Shizai proved to be very beneficial for our periodontal patient. It is exciting that periodontal health and thus overall body health can be improved by drinking healthy chocolate. It is somewhat of a paradigm shift, recommending chocolate at a dental office, but the patients love it. I would like to thank my dental team for making this study possible. A special thanks to my 3 hygienists, Sissy Isaac, Karen Selko, Trish Winch, and their assistant, Jamie Kazir. I'd like to also thank Dr. Steve Warren and everyone at MXI Corporation. Thank you and have a wonderful time here in Salt Lake City and a great day.